What does week 6 or 7 look like as a speech therapist when I see my head and neck cancer patient who's in treatment? So I have a patient who's going through head and neck cancer treatment, and that patient has been referred to me. I have seen them proactively, hopefully prior to the start of their radiation. I've now seen them either weeks 1 or 2 and Q2 weeks 3 or 4. So now I'm seeing my patient for the 3rd time, and for the 3rd time, I'm going to see them at the end of their treatment. This is typically somewhere around week 6 or 7, depending on the patient. 84% of you who watch this channel do not subscribe, so consider subscribing so that we can grow our guests and our education content. So, week 6 or 7, my patient is going to be experiencing significant side effects of treatment. These are considered acute side effects, and these side effects will resolve as the radiation has stopped, hopefully soon. The resolution of those side effects is different for every patient. Now, what are some of the external side effects that I may see in my patient? I may see radiation burns along the neck. I may see tissue or skin changes along the neck and along the face in those fields of radiation. I may also have a patient sitting in front of me who doesn't want to eat and drink due to the pain and the burning sensation as they're swallowing. My goal at this point in week 6 or 7, take 2 pathways. The first pathway is if my patient does not have a feeding tube. I am typically trying to continue to find ways that they can safely swallow and keep their nutrition and hydration without a feeding tube. That may look like liquid diets and collaborating with the registered dietitian to ensure that all of their medical needs are also being met. The second pathway is a different pathway. Some patients at this point in the treatment have had such adverse side effects that they do require a feeding tube. Oftentimes, a percutaneous gastro feeding tube is placed. That's a PEG tube, and that tube is placed in my patient's abdomen or belly, and those patients, I am hopeful that they can continue to swallow sips of water, ice, or other things so that they are still working their swallowing muscles. So when a patient comes in week 6 or 7 of treatment, there are some serious side effects that we are often working with. We are trying to compensate for those side effects. Most of the time at this point, my patients have stopped their exercises. They are not continuing to do their exercises due to the radiation burns, due to what is called odynophagia or pain with swallowing. It is expected that their mouth opening has decreased at this point, usually around 30% from the original measurement prior to treatment. And that is because of the edema that is impacted in the swelling from the radiation. So that's a normal side effect that occurs. We will work on improving the mouth opening once all of the side effects have resolved, typically around 6 to 8 weeks following completion of their radiation. So the last few weeks of treatment, we are encouraging our patients, keep going, get through this, you can do it, because they are losing some light at the end of the tunnel and they are in significant amounts of pain. We work closely with their physicians to ensure that their plan is as optimal as it can be with continued realistic expectations for each of our patients.